Rukunyu General Hospital in Kamwenge district registers at least 300 mothers taking antenatal services every month. The facility reports that of these, 15 mothers do not get to the pride and joy of motherhood after failing to get a normal delivery.
If you go to PD ward, you find like 50% related to malnutrition, because you see a few malaria, pneumonia cases, but you find a lot of nutritional deficiencies there leading to serious bacterial infections. So in one or another, it is giving us a big burden.
The district reports high rates of premature births and miscarriages attributed to rampant malnutrition among mothers.
Most of the community people here, the pregnant mothers, they have enough food, but how to use the food in the right way contributes much towards the outcome of delivery. Because most of the time, they grow a lot of matoke, they grow a lot of beans, they grow a lot of Irish, potatoes, but most of those foods, they are sold, and for them, they eat the bad ones.
The head of Rukunyu General Hospital, Dr. Ivan Mujuni, says expectant mothers coming for antenatal services are frequently found with stunted pregnancies due to malnutrition, which cause rampant miscarriages, while others do not get to their due dates of delivery.
You'll find more than half are due to the mother having a very low HB. And the low HB is actually not because the mother had severe malaria or something. Actually, the mother has not been feeding well.
He adds that this also contributes to mothers delivering low-weight babies, while other newborns do not get an opportunity to live beyond 6 months due to poor child feeding and care.
We have been experiencing a lot of low birth weight children. We have had a lot of preterm babies. Actually, our nature has been full of preterm babies, with anemia. They don't grow, you have preterm deliveries. So I've been having, maybe I could say it was like an outbreak of preterm labor.
Kamwenge district has always had quite high levels of malnutrition among children below 10 years, although UNICEF has had multiple interventions working with UK Aid.
So with the strategy of giving the community awareness that have an animal protein, for example, milk, an egg, small fish or meat if you can. We have started realizing that the issues of stunting are reducing.
The escalation in the number of malnutrition cases in Kamwenge district is attributed to poor child care, where most mothers don't want to breastfeed their children and spend much time in looking for money.
Sale of food, that's one still the big challenge. Then of course mindset. Some people still have weird thinkings regarding health, regarding nutrition. So we are dealing with that. Social behavior change. It is also incorporated in our program of community.
Apparently, Dr. Mujuni says the numbers have dropped compared to the last few years, although sensitization along new mothers is still critical.
When we started this program a few years back, we had a serious gap. But with these many interventions, like especially in trainings and community programs, we can see the cases have become few. We no longer have a lot of blood transfusions.
At least 30% of the government annual allocation to the facility is spent on treating ailments related to malnutrition in the district. The annual budgetary allocation for the hospital stands at 600 million shillings. Mujuni calls for government to further empower the village health teams who directly relate with the grassroots communities to help avert such ailments related to malnutrition.
If we continue investing in capacity building of the service providers and that new community program, which is actually trying to link the facilities with the community, especially those grassroots health workers, the VHTs, we keep on collecting data. We can see where the biggest problem is coming from, and we can always allocate more resources, more outreaches to those specific areas.
In the health ministry and local government set up, village health team personnel are not paid a salary, but rather a periodical stipend to cover limited costs like transport within their parishes, which is also less. Becca Senyonga Mlinde, NTV Weekend Edition.